because a lot of places in Europe are starting to drop the restless leg syndrome tag because people feel it sounds trivial.
Well, yeah, and I guess I think we can all understand that. We can relate to that, can't we? Because certainly as a practitioner myself in the past, I mean, people have talked about restless legs and I think, oh, you're a bit fidgety. So what is it like? What are the actual implications for a patient, for a sufferer?
I think first thing to say is what it isn't, which is jiggly legs. The sort of thing people do when they're sitting there, maybe if they're a bit nervous and so on. Very definitely not that. Restless leg syndrome is defined by a series of criteria, actually only 4. And the key one is an almost irresistible urge to move your legs, which is associated with unpleasant, sometimes painful sensations, which could be throbbing, burning, strange feeling of sort of bubbling in the veins. People talk about having insects under the skin and so on. And that sensation and that need to move builds and builds and builds until you have to move. The second criteria is that when you do move, you get some relief, but only temporary, and it can then come back again. Third thing is that this happens when you're at rest, and that is sort of when you're sitting or lying down or trying to sleep. And finally, it tends to be worse in the evenings and get better in the mornings. Having said all of that, when the disease gets more serious, it can spread from the legs to the arms, sometimes to the trunk. It can happen earlier in the day. And also you can have an association with periodic limb movement of sleep, which is a forced dorsiflexion of the foot, lasting between half a second and 5 seconds, occurring every 30 to 40 seconds, which can happen all night. And obviously that's very distressing, both for the person who has it and also if they have a partner. Being in a bed with somebody who's jerking continuously all night is not good news.